Your doctor probably never told you this about testosterone, and it could explain everything you've been feeling. So this is one of the things I get asked about constantly, and it's also one of the most misunderstood areas in women's health, and I think it's misunderstood even within medicine, which is why so many women are being failed. Let me start with a fact that genuinely surprises most people. Testosterone is actually the most abundant sex hormone in a woman's body. More abundant than estrogen, more abundant than progesterone. Most women have never been told that, and yet when it declines, which it does from your late 20s, early 30s, the effects are profound and they go largely unrecognised. We have this idea that testosterone is a male hormone. It's not, it's a human hormone. Women need it just as much as men do, just in smaller amounts, and when those amounts drop, the impact on a woman's quality of life can be absolutely enormous. The presentation is so varied, which is part of why it gets missed. Women come in and they describe feeling exhausted in a way that sleep doesn't fix. There's a flatness to their mood, not necessarily depression in the clinical sense, but a loss of motivation, a loss of that get up and go feeling they used to have. They describe not feeling like themselves. Then there's the libido piece. Zero interest in sex, which can be devastating for relationships and for a woman's own sense of identity and femininity. And it's not just desire, there's also reduced sensitivity, which means sex is less enjoyable, even when it does happen. Brain fog is huge. Difficulty concentrating, struggling to find words. Women often tell me they feel like they're thinking through treacle. And then there's the physical side. Loss of muscle tone, even with exercise, increased body fat, particularly around the middle, and a loss of that feeling of physical strength. What's heartbreaking is that many of these women have been told it's stress, or they've been put on antidepressants, or they've been told this is just what getting older feels like. And I just think, no, this is not acceptable. There is a physiological reason for how you feel, and there are options. This is such an important question because it points to a real systemic gap. The standard NHS blood panel does not routinely test free testosterone in women. It's just not included. And even when total testosterone is tested, the reference ranges used are often calibrated for men, or they're so broad as to be almost meaningless. You can have a testosterone level that sits within the so-called normal range and still be symptomatic. Because what matters is not just how much testosterone is in your blood, it's how much of it is actually available for your body to use. That's what we call free testosterone, and that's what most women are never tested for. There's also a conversion issue. Testosterone gets converted into other things in the body, and if that conversion process isn't working as it should, you can have what looks like a normal reading and still be functionally deficient. So when someone comes to me and says, "My bloods are normal, but I feel awful," I believe them, because often the bloods are telling an incomplete story. So much more than most people realise, and this is why I get passionate about this, because it's not just about someone's sex life, though that matters enormously and I never want to diminish that. It's about long-term health. Bone density. Testosterone plays a direct role in bone formation and in keeping bones strong. When it declines, and estrogen declines alongside it in perimenopause and menopause, the risk of osteoporosis increases significantly. We know that 1 in 2 women over 50 will experience an osteoporosis-related fracture. 1 in 2. And testosterone is part of that protection against that. Cardiovascular health. There are testosterone receptors in the heart muscle and in blood vessels. Testosterone helps maintain healthy cholesterol, helps maintain vascular tone, so the cardiovascular protection it offers is real and it matters. Brain health. There's growing evidence, and this is an area of active research, that testosterone plays a role in cognitive function and may even have a protective effect against dementia. When women come to me describing brain fog and memory issues, the hormonal picture is always part of the conversation. And then muscle mass. As we age, we naturally lose muscle. It's called sarcopenia. Testosterone is critical to maintaining muscle mass, to be able to exercise effectively, to maintain a healthy body composition. When it drops, the battle against weight gain becomes so much harder, even for women who are doing everything right. I hear this all the time and I completely understand it because the information that's out there is so muddled. And some of it comes from genuinely misapplying what we know about anabolic steroids in sport or very high dose testosterone used in male medicine to the completely different context of physiological replacement doses for women. We're talking about tiny amounts. The doses used in female testosterone therapy are a fraction of what a man would use. We're talking about restoring a woman's level to what they would have been when she was in her 20s, not raising them above that, not pushing them to male levels. When that's done correctly, the risks of virilization, things like excess body hair or voice changes, are extremely low. And the evidence on this is actually reassuring. The data we have from studies on testosterone in women shows good safety profiles when used at appropriate doses under medical supervision. The British Menopause Society and the International Menopause Society both acknowledge the role of testosterone in female health. It's body identical, it's not synthetic, it's not a foreign substance, it's something your body already makes and has always made. What I often say to patients is, I'm not giving you something new, I'm giving you back something you've lost. And when you frame it in that way, a lot of the fear starts to dissolve. First, trust yourself. If you feel like something is wrong, something is wrong. Do not let anyone tell you that what you're experiencing is just life or just stress or just part of getting older. You deserve to feel well. Get a full hormonal panel, not just the basic one. Ask specifically for free testosterone, estradiol, progesterone, DHEA, SHBG. Find a doctor who has specific training and experience in menopause and hormonal health. Not all GPs have that, and it's not their fault because menopause training in medical schools has historically been woefully inadequate. But it does mean that you may need to look further. And if you want to speak to me directly, you can come and see me at my clinic or book a consultation online. I offer both in-person and virtual appointments because nobody should be sitting at home feeling exhausted and flat like a shadow of themselves, wondering if this is just how their life has to be now. It doesn't have to be.